So, good evening to everyone and welcome to today's wonderful evening with Dr. Murali Bharadwaj. Ultimately, what is the secret of winning the NEET PG? It's not, we read a lot from the ocean of 20 subjects. We need to sharpen the saw based on the previous year questions. What examiner is going to ask us in the tomorrow's NEET PG? So for that, we need a classmate who will give us questions, and we all sit together and answer those quick facts that we are supposed to master. So there are 10,000 PYQs based on the last 12 years of question papers. So we created around 50,000 high-yield facts and then divided them into fill up the blanks, which is a sharp revision, facts, which you need to be good with for the last moment of preparation. This is purely PYQ stuff. So that will be very, very high yield, definitely. So only thing is you need some motivation to rapidly ratta marne ke liye on these 50,000 high yield facts. Let us see how fast we will do this. And very nice to see 13 online classmates. Thank you all. Can you please punch us our voice loud and clear for all of you, doctor? Nice to see Madhuri and many more. Please inform all your friends also. So every sprint has 100 high yield facts. So how many sprints we need to do to finish 50,000 high yield facts? As the fill up the blanks, at least 500 sprints we need to do quickly. Let us see how much time we rapidly revise these 100 high yield facts. Before only, I'll give these 100 high yield facts like a fill up the blanks for you in the WhatsApp group. You try to sit with your friend and try to answer. And now what I'm doing is a revision of those 100 high yield facts, which I gave as the fill up the blanks to you. So like this, what we can do in 500 quick sprints, they're called 100 sprints, 50,000 high yield, hot facts asked by the examiner, which are there in the question bank of the examiner. We are going to do the revision. Nice to see Dr. Sandeep, Parmar, and many more who are all online. So let's shuru kare the rapid sprint. So doctor, can all the students can say, is the voice loud and clear for all of you? Yes. Now, what is the most common cause of microcytic anemia? These are all based upon the PYQs, iron deficiency. What is the hallmark of the folate deficiency? It is the hypersegmented neutrophils. Pernicious anemia, it is due to the vitamin B12 deficiency. What type of anemia is anemia of chronic disease? Whenever there is any TB, rheumatoid arthritis, whenever there is any inflammation, typically we get anemia of chronic disease. It is normocytic, normochromic is what you need to remember. Hemophilia A is the factor 8 deficiency. Hemophilia B is factor 9 deficiency is what you need to remember. Now, G6PD deficiency, it typically leads to hemolytic anemia after oxidative stress. So typically a clinical vignette will be given in the tomorrow's exam, doctor. Yes. So Madhuri is saying, sir, I'm waiting for your class since 31st because your mock test will be available. The notification came. Oh my God. So definitely first already we launched 27 mock tests. Remaining mock tests also will be launched quickly. But one request came from many students that mock tests are great, sir. The explanatory answers are all very self-explaining in the form of mind maps. That's the reason, why don't you do something that will help us for the last moment revision in the leftover 20 days? Then I thought, why not the 50,000 high yield facts based upon the 10,000 PYQs, as many as possible, give you like a sprint and fill up the blanks for you to do the revision. I thought is a better way to do it, right? Yeah. So Raj is asking, sir, can you share PDF? Definitely. If you're in our WhatsApp study group, I'll share into that. Don't worry. Now, doctor, yeah. What is hereditary spherocytosis is because of? It is due to the spectrin deficiency. The keyword spectrin is important in the RBC membrane proteins. So what is thalassemia? Thalassemia, is it a qualitative or a quantitative defect? It is a qualitative or a quantitative. It is a quantitative defect in the globin chain production is what you need to remember. We see Reed-Steinberg cells in the Hodgkin's lymphoma. Multiple myeloma typically show young peak. What is it called? Young peak. So what do you get in multiple myeloma, doctor? High ESR, severe bone pains, elderly female presenting with anemia is a classical presentation. There will be lytic bone lesions. And typically alkaline phosphatase will be normal, but there will be hypercalcemia, which is very, very important point to be remembered. Hypercalcemia with a normal alkaline phosphatase is multiple myeloma. Whereas normocalcemia with a high alkaline phosphatase is, you should remember, Paget's disease is what you should remember. Now, what is the poor prognostic factor in multiple myeloma? Many times this question was asked. It is the beta 2 microglobulin is what you need to remember. Now, what is the most common leukemia in adults? Once the people reach about 70, 80 years, they are completely asymptomatic, but a complete blood picture was done. And when the peripheral smear is prepared, smudge cells will be formed. That's how we discover chronic lymphocytic leukemia. So CLL is the most common in adults. Now, what is Philadelphia chromosome, doctor? Please don't forget the number. T922 is the one associated with CML. So where do you see R rods, which are very classical in blast? So once more, go to the Google images, doctor. R rods को इमेज फॉर्म में इमेज बेस्ड एमसीक्यू बहुत शानदार फेवरेट क्वेश्चन होता है एग्जामिनर के लिए. That's the reason you have to be very sure. In AML, you get all rods in the blacks. The most common childhood leukemia क्या होता है? Childhood leukemia होता है ALL. And all the good, bad prognostic factors about the ALL, the list you need to be very sure about that. Burkitt's lymphoma में क्या होता है? C-mic translocation. C-mic translocation. Every time they ask this question, बच्चों, you need to remember. And what is the translocation in Burkitt's? T8 to 14. Once more, you'll be listening to Murli Bharadwaj in the exam hall. आपके कानों में सुनाई देगा. C-mic translocation T8 to 14 is what you need to remember about Burkitt. And what is follicular lymphoma? Please don't forget. Follicular lymphoma is BCL2 translocation. BCL2 translocation. And T14, 18 is the one which you need to remember when it comes to follicular lymphoma. Mycosis fungoides is also called cutaneous T-cell lymphoma. What are the two buzzwords you'll remember? Sézary syndrome, cerebriform nucleus, like brain ka cerebrum, cerebriform nucleus is what you see in mycosis fungoides. It presents like skin patches and clots. ये भी इमेज वाला एमसीक्यू है, जरूर आएगा कल के नीट पीजी में. Essential thrombocythemia. It is one of the myeloproliferative conditions, just like polycythemia rubra vera. Polycythemia rubra vera, you have essential thrombocythemia, where there is an elevated platelet count, is what you need to remember. Polycythemia rubra vera में क्या होता है? If you do bone marrow, there is an increased erythroid precursor cell mass. Generally, how do you know whether it is polycythemia rubra vera, which is also called the main problem, myeloproliferative problem in the bone marrow? Is it, or is it a secondary polycythemia, like you get it in anemic patients? Similarly, you get somebody who has a congenital heart disease, cyanotic heart disease, bad lungs like emphysema. Anything can lead to polycythemia, but that is all secondary. So how do you differentiate polycythemia rubra vera from the secondary polycythemia? Polycythemia rubra vera में erythropoietin levels low होता है, whereas secondary polycythemia में erythropoietin levels will be high. That is the differentiator. Okay. Now, myelodysplastic syndromes, what are they? They are the clonal bone marrow disorders. What is the favorite way of asking question? A patient is having a refractory megaloblastic anemia. आप विटामिन B12 दिया, फिर भी एनीमिया सबसाइड नहीं हुआ. Recurrently refractory megaloblastic anemia, refractory to the treatment with vitamin B12. Then we will think about myelodysplastic syndrome. Just like cervical dysplasia lead to cervical cancer, bronchodysplasia lead to lung carcinoma, myelodysplasia lead to myeloid leukemia. That's what you should remember. Now, what is the cause? Whenever somebody has a chronic kidney disease, they develop anemia because there is a decreased erythropoietin. That's the reason. All renal failure patients, tomorrow some of you are going to be top nephrologists. We give erythropoietin injection in order to treat the anemia which you see in chronic kidney disease. Then hemolytic uremic syndrome is associated with E. coli O157 strain. So these are all the classical buzzwords, doctor. Please don't forget. E. coli O157. Then TTP, thrombotic, thrombocytopenic purpura. Immediately you should remember Adam TS13 deficiency. पूरा 50,000 हाई यील्ड फैक्ट्स को भजन करना है, भजन करना है कल के एग्जाम के लिए. Suppose if the examiner asks, most common inherited bleeding disorder, and अगर आप हीमोफीलिया आंसर करें तो सत्यानाश हो जाएगा. Most common inherited bleeding disorder is not hemophilia. It is von Willebrand disease, is what you need to basically remember. So what is ITP? Typically, patient gets a fever. Following that, there is a development of petechiae, platelet count is low. That's how it is called ITP. ITP is because the autoantibodies against the platelets. So whenever you are giving heparin, some of the people whom you are giving heparin lead to heparin-induced thrombocytopenia. इसको कहते हैं हिट. हिट में 2 types, हिट type 1, type 2 होता है. आप immediately go back and do the revision, doctor. HIT is because of what? Antibodies to heparin PF4 complex. Heparin and PF4 complex के antibody इसके वजह से heparin induced thrombocytopenia होगा, is what you need to remember. So what is warfarin? Warfarin is vitamin K dependent factors. What are they? 2, 7, 9, 10. 2, 7, 9, 10. They're all vitamin K dependent factors. Now, what are all the direct oral anticoagulants that you need to remember, doctor? Dabigatran, rivaroxaban, and apixaban. These are all called direct. For example, if you take heparin, why heparin is called an indirect anticoagulant? Because heparin will go, it will activate antithrombin. Antithrombin will in turn will cause the inhibition of thrombin. Thrombin is nothing but activated factor 2. Okay. Whereas without any dependence on the antithrombin, directly if the anticoagulant go, right? Anticoagulant go without depending on antithrombin and lead to the development of antithrombotic state, that is called direct anticoagulant. उसमें oral क्या होता है? You should remember dabigatran, rivaroxaban, and apixaban is what you need to basically remember. So what does aspirin does? Aspirin irreversibly inhibits, not reversible, irreversibly. COX-1, not COX-2 is what you should remember. How does clopidogrel function? Clopidogrel is a ADP receptor antagonist is what you need to remember. And what is apixaban? Apixaban is also an antiplatelet, but glycoprotein 2B3A inhibitor. 2B3A inhibitor is what you should remember. And in von Willebrand, what do we give? Desmopressin, because desmopressin increases the von Willebrand factor release. What is hereditary angioedema? It is because of the C1 esterase inhibitor deficiency. So these are all such a hottest single liner facts that you should be ready. If you are ready with 50,000 high yield facts, nobody will stop you from cracking the NEET-PG. Now, common variable immunodeficiency. It is low immunoglobulins. Whereas severe combined immune deficiency, SCID, is due to lack of both the T cells, cell-mediated, and also the B cells. That's what you should remember. X-linked gamma globulinemia. It is because of BTK gene mutation. BTK. Battimaro BTK gene mutation is X-linked gamma globulinemia. What is DiGeorge syndrome? It involves 22q11 deletion is what you should remember. And what is Wiskott-Aldrich? Where triad kya hota hai? What is the triad in Wiskott-Aldrich? You should remember eczema, thrombocytopenia, and immunodeficiency. This combination is called Wiskott-Aldrich. And what is chronic granulomatous disease? It is a defective NADPH oxidase defect is called chronic granulomatous. Leukocyte adhesion deficiency, LAD, is another important immunodeficiency state. It is because of CD18 deficiency is what you have to basically remember. Celiac Higashiosis. It involves mainly the lysosomal trafficking regulator gene defect. What is that called? Lysosomal trafficking regulator gene defect is typically celiac Higashiosis. Hyper IgE syndrome को क्या बोलते हैं भैया? जॉब सिंड्रोम में किसका म्यूटेशन होता है? STAT3 म्यूटेशन typically is hyper IgE syndrome. Ataxia telangiectasia. What is that gene? ATM gene mutation is ataxia telangiectasia. How do you treat anaphylaxis? We give IM epinephrine. IM epinephrine is what you have to basically remember. Type 1 hypersensitivity में क्या होता है? IgE mediated mast cell degranulation. Type 2 hypersensitivity में antibody mediated cell destruction. Type 3 में immune complex deposition. Type 4 में T cell mediated delayed hypersensitivity is type 4. And what do you see in SLE? Anti-dsDNA antibodies. What are the antibodies in rheumatoid arthritis? Very specific antibody, anti-CCP antibodies. Sjogren's में क्या होता है? Anti-Rho, anti-Law antibodies is what you should remember. Systemic sclerosis में क्या होता है? anti-SCL70 antibodies. And polymyositis में क्या होता है? Anti-Jovan antibodies. Gauthran's papules, heliotrope rash in a person presenting with proximal muscle weakness. Where do you see? Dermatomyositis. Mixed connective tissue disease में क्या होता है? Anti-U1 RNP antibodies is what you should remember. What is Beset? Beset is recurrent orogenital ulcers is called as the Beset syndrome. Beset's syndrome. What is Kawasaki? Kawasaki में coronary artery aneurysms. Heart attack in a small pediatric patient is Kawasaki. In that there is non-exudative conjunctival inflammation, conjunctivitis. Strawberry tongue will be there, right? Mucocutaneous vasculitis it is. So coronary artery aneurysm. PAN, polyarteritis nodosa, is a kind of a medium-sized arteritis. Once more, vasculitis, every entrance may one question aayega, doctor. You should be very sure. So polyarteritis nodosa, Kawasaki disease, they're all medium-sized arteries. Vaginal में Sianka, microscopic polyangiitis में Pianka antibodies. Please don't forget. Which vasculitis presents with eosinophilia and asthma? You should remember Churg-Strauss syndrome. And temporal artery inflammation is a feature of giant cell arteritis. Which condition is called pulseless disease, doctor? Takayasu arthritis is what you need to remember. Involves large vessel inflammation. Henoch-Collins purpura. In this, it is also called IgA nephropathy. Henoch-Collins are two ends of the spectrum. It is a IgA deposition is what you see. Good posture may anti-GBM antibodies will be there. Alport syndrome may which type of collagen? Type 4 collagen need to be remembered. AS4 titers are seen in PSGN, post-streptococcal glomerulonephritis. And spike and dome pattern, which glomerulonephritis you see on electron microscopy, doctor? Membranous nephropathy may. So all glomerulonephritis you should master. Podocyte effacement. Podocyte effacement, if you do electron microscopy, typically is the feature of minimal change disease. Segmental sclerosis is a feature of FSGS, focal segmental glomerulosclerosis. Kimmelstein-Wilson's nodule, classical of nodular glomerulosclerosis you see in diabetic nephropathy. And where do you see muddy brown cast, doctor? Tomorrow's NEET-PG exam, they are going to give you the image-based MCQ. Muddy brown cast, typically seen in acute tubular necrosis. Eosinophiluria is a feature of acute interstitial nephritis. And what are the genes involved in ADPKD? PKD1, PKD2 genes. And what is nephrotic syndrome? Whenever proteinuria is more than 3.5 grams per day is what you should remember. Hematuria, RBC casts are the hallmark of nephritic syndrome. So where do you see T-wave flattening, doctor? Hypokalemia. Where do you see peak T-waves? Hyperkalemia. Hypercalcemia में होता है shortened QT. Hypocalcemia में होता है prolonged QT. Sure, short MCQ in the tomorrow's NEET-PG exam, doctor. Loss of deep tendon reflexes is the way by which hypermagnesemia present. That's the reason whenever you are giving max sulfate. How do you know the max sulfate toxicity? By looking at the deep tendon reflexes, respiratory rate, etc. Now, torsades de pointes happens whenever there is any hypomagnesemia, low magnesium levels. That's the reason to treat the torsades de pointes, we give magnesium also. Very nice to see Ravinder Singh from Punjab and many more who are all online. So, Addison's disease. Low cortisol, high ACTH means adrenal destruction. And any autoimmune destruction of adrenal is called Addison, is what you need to remember. Cushing में होता है high cortisol levels. What is primary hyperaldosteronism? It is also called Conn's syndrome. Without any renin, aldosterone is produced if the adrenal adenoma is there. That's the reason low renin with high aldosterone characterizes the primary hyperaldosteronism. Whereas high renin with high aldosterone is the feature of secondary hyperaldosteronism. Whenever we are dehydrated is what you need to remember. Pheochromocytoma में क्या होता है? Episodic hypertension and catecholamine excess, all of you know. Now, what is primary hyperparathyroidism versus secondary? Primary hyperparathyroidism occurs because of parathyroid adenoma. So there, PTH is high, calcium is high. Secondary hyperparathyroidism is whenever you have a low calcium levels, as in the case of the renal failure, where there is no vitamin D. If the vitamin D is not there in renal failure, that leads to low calcium, and that stimulates the PTH from the parathyroid. So that's the reason high PTH with low calcium is secondary hyperparathyroidism, whereas high calcium, high PTH is the primary hyperparathyroidism. Low calcium and low PTH is a feature of hypoparathyroidism, is what you need to remember. What happens in Graves? Thyroid stimulating immunoglobulins, TSAPs, thyroid stimulating antibodies will be formed. Where do you see anti-TPO antibodies, doctor? Hashimoto's thyroiditis. Which thyroiditis lead to painful thyroid gland? Subacute thyroiditis. Where do you see orphan Annie, I nuclei, doctor? This is a favorite image-based MCQ in the NEET-PG. Papillary thyroid carcinoma. And how does it spread? Lymphatically. Whereas follicular thyroid carcinoma involves hematogenous spread. Which thyroid carcinoma may calcitonin levels are increased, typically in medullary thyroid carcinoma. And which thyroid cancer has a very rapid growth and poor prognosis. And a plastic thyroid carcinoma is what you should remember. So that brings us to the end of this wonderful evening, doctor. We are able to finish 100 high-yield facts in 25 minutes. In 1 hour, 200 high-yield facts. That means we will take 250 hours to finish 50,000 high-yield facts revision. Right? Maza aa gaya na? So, last moment में क्या होना डॉक्टर? भूलना नहीं. Favorite high yield points based on the PYQs. उसका preparation करना. 50,000 high yield facts का preparation होना based on the PYQs. That is all that is needed, nothing else. There is no intelligence involved. Dyejar syndrome involves chromosome 21 or 22 or 20 or 19 or 18. Examiner will try to chase you. You need to remember, right? I'm the classmate who will hold your hand, will always be there with you to push you. In addition to this, our regular mock test, 50 full-scale grant tests are already published. Already 27 grant tests are published, doctor. Every grant test has got a detailed 200 mind maps of explanation, which is more than enough. So prepare with full energy. Still, we have 20 more days for us to become the topper. So good night and be part of our WhatsApp study group. Every time I get time, I keep conducting this kind of 25-minute, 30-minute sprints with around 100 high-yield facts. Before I start the session, I'll post these 100 high-yield facts in the form of fill up the blanks in the WhatsApp study group. That way, charge your preparation, and I am your classmate, roommate, tablemate, benchmate to come with you to the NEET-PG exam hall and wait until you finish the exam and come out anxiously looking forward how the kids have performed. Good night, doctor.